We can now mark very, very small nodules, even 2 or 3 millimeters, which would be a 20th of an inch, with a small 3 millimeter gold marker called a fiducial. Those are put in prior to surgery by the radiologist. They're done under CAT scan guidance, where a small needle is placed between the ribs and the marker is deployed next to the nodule that we're concerned about. The patients are then brought to the operating room, and we use a live x-ray called fluoroscopy to identify the nodule and remove it. And this is kind of my thought, is that in conjunction with our advances in CAT scans really is enabling us to identify lung cancer sooner. And so we now have what are called high resolution CAT scans, which really allow us to see very, very small nodules. What the differentiation between a high resolution CAT scan and a low resolution CAT scan is kind of like your high def television versus the old black and white. So 10 years ago, the CAT scans would travel a quarter of an inch between every picture they took. And so nodules smaller than a quarter of an inch could easily be missed. The CAT scans now, they're traveling 1.25 millimeters, I mean barely imperceptible how far they travel between each picture, which means we can find nodules that are 2 millimeters in size and take out nodules that are much smaller. So what's the benefit of that? Well, currently the standard treatment for removing a lung cancer is to do a lobectomy. That means removing on the left either half of the lung, or on the right up to a third of the lung, for even cancers that are as small as an inch, which seems kind of crazy. You're taking out this huge piece of lung, which is probably removing about 15% of somebody's breathing capacity for a little teeny tiny lung cancer. Well, if you can find these things when they're 2 or 3 millimeters and snip them out with a small piece of lung, it's a 45-minute operation, it's an overnight stay in the hospital, and it's really does not affect the patient's quality of life, breathing capacity at all. That's, to me, that's the future of lung cancer surgery.